to one of the research papers that deal with the heart disease detection using a machine learning. In this presentation, the heart disease detection method using a machine learning is studied. This work is done by the collaboration of some of the colleagues in different departments: Dr. Mohammad Al-Habahbeh, Dr. Moath Alomari, Dr. Hebatullah Khattab, Dr. Raed Alazaidah, Dr. Nawaf Alshdaifat, Dr. Suhaila Abuowaida, Dr. Saleh Alqatan, and Dr. Mohammad Arabiat. In a brief introduction regarding the heart diseases, including coronary artery diseases, arrhythmias, and heart failure, are a serious health issues that can lead to complication and even death in some cases. According to the WHO, or the World Health Organization, in 2019, approximately 17.9 million people died due to the cardiovascular diseases, and this accounts for approximately 32% of the global death. From the 32% global deaths because of the cardiovascular diseases, the heart attacks and the strokes were the leading cause and accounting for approximately 85% of these deaths. So, in this part, the early detection is crucial for timely intervention, prevention, severe complication, and for sure, improving the patient outcomes and quality of life. In this regard, the traditional method for heart disease detection often involve manual assessment, clinical examination, and basic diagnostic tests. But, however, the modern approaches, especially that incorporate machine learning, the ML machine learning, leverage advanced algorithms to analyze complex data sets for diverse sources, such as the patient history, the genetic information, and the medical imaging, which enable a more accurate prediction. So, the machine learning is crucial in detecting heart diseases by analyzing large data sets to identify patterns and markers. It processes patient data like medical history, imaging, and genetic information, enabling the precise diagnosis. So, the ML algorithms help healthcare participants to predict risks, enhance accuracy, and improve the personalized treatment strategy, which ultimately improve the patient outcome and reducing the healthcare burdens. So, the motivation behind the investigation of heart diseases detection using machine learning arises from the urgency to enhance early identification of cardiac conditions. So, in this research paper, the research objectives were two main objectives. The first objective is to determine the most efficient classifier for identifying heart diseases among 29 different classifiers, such as the BEEI, the SGD, and the plugin that represents 6 distinct learning strategies. Where the second main objective for this research paper is to identify the most effective method for selecting features in heart disease datasets. In regard the description of the datasets, the datasets were included in this work are two datasets: dataset 1, DS1, and dataset 2, DS2. In dataset 1, DS1, the instances were 606, whereas in dataset 2, the instances were 303. In regard to the features, regarding the dataset 1, the features were 14, and in dataset 2, features were 14. Again. Now, in regard the methodology for this research paper compromised mainly 3 stages: stage 1, 2, and 3. In the initial stage deal with collecting data, in which 2 data sets were prepared, and these 2 data sets were acquired and downloaded from the UCI department, whereas the second stage involved the pre-processing data. The pre-processing data means involving doing various tasks such as data cleaning, handling of the missing data, data reduction, and other related operations in order to make the data ready for the analysis. Whereas in the third phase determines the optimal classifier for hard data sets. In this phase, various evaluation criteria were incorporated, including the accuracy A, the precision P, the recall R, and the F1 score F1. Also, in this stage, 29 distinct classifiers that are part of 6 widely recognized learning techniques are used. Now, in order to identify the best classifier, a comprehensive evaluation and comparison were conducted on 29 classifiers from 6 different learning strategies to identify the most effective classifier for handling the considered datasets. These classifiers have been utilized with their default implementation in WEKA, which means the WEKA to Evolutionary Knowledge Analysis. In WEKA, the evaluation steps used a 29 classifier considering main 4 metrics: accuracy, precision, recall, and the F1 score. In order to identify the best classifier, the metrics are calculated using the following formula. And regarding the accuracy, we have TP plus TN divided by TP plus TN plus FP plus FN. In regard the precision, TP divided by TP plus FP. In regard the recall, TP is divided by TP plus FN. In regard F2, the F2 is 2 by precision by recall divided by precision and the recall plus the recall, in which TP is the number of samples correctly predicted as positive, where the FP is the number of samples wrongly predicted as positive, TN, number of samples correctly predicted as negative, FN, number of samples wrongly predicted as negative. From these four formulas, the four formulas are used to calculate them. The performance of the 29 classifier using dataset 1 is presented in this slide. And the performance of the 29 classifier using dataset 2 is presented in this slide. The overall summarization of the best classifier for each dataset is as following. Regarding dataset 1, the best classifier were RandomCommittee, in which A is 98.68%, the P is 0.99, the R is 0.99, the F1 is 0.999. And regard dataset 2, the best classifier were SGD, multi-class classifier updatable, and the A is 83.83, the P is 0.84, the R is 0.84, and F1 is 0.84. So, based on the tables, the following are the best classifier for each dataset. In regard to dataset 1, the best classifier is RandomCommittee and the learning strategy meta. It has the highest accuracy with 98.68 and precision of 0.99, recall of 0.99, F1 score with 0.99 among all classifiers in this dataset. In regard to dataset 2, the best classifier is the SGD in learning strategy function and multi-class classifier updatable in learning strategy meta. Both have the highest accuracy with 83.83%, precision with 0.84, recall with 0.84, and F1 score with 0.84 among all the classifier in the data set. So, the best feature selection method regarding this part, the 4 distinct feature selection approaches have been selected to assess and compare their suitability for the heart disease domain. In regard the evaluation was based on 4 metrics: accuracy, precision, recall, and F1 score. In regard the selection of these approaches, it was based on their widespread use in the field of machine learning. So, the chosen feature selection method including classifier attribute eval, classifier AE, correlation attribute eval, correlation AE, gain ratio attribute eval, gain ratio, and info gain attribute eval, info gain. All these feature selection techniques have been utilized with their default configuration as they have been implemented in the WEKA. The result of the evaluation for the 2 feature selection method for dataset 1 is presented here, as we can see, and for the dataset 1, also the 2 feature selection is presented here regarding the gain ratio 1 and the info gain 1 in the dataset 1, and here the classifier AE in dataset 1 and the correlation AE in dataset 1. Moreover, the evaluation result for the 2 feature selection method for dataset 2 is presented in this slide with the classifier AE and correlation AE. In regard the result and the discussion, the results provide an insight into the most effective classifier and feature selection methods for handling datasets related to heart diseases. The chosen classifier and feature selection method have undergone comprehensive evaluation using important performance measures, including the accuracy, precision, recall, and the F1 score. And these are used across a separated datasets. When examining classifier, it became clear that RandomCommittee constantly outperforms other methods on various datasets, demonstrating exceptional results in terms of accuracy, precision, recall, and F1 score as mentioned earlier. The strong performance of RandomCommittee, particularly in dataset 1, underscores its dependability in managing heart disease-related data. Furthermore, the paper demonstrated that the SGD, when used as a learning strategy function, and the multi-class classifier updatable when used as a learning strategy meta show impressive performance in dataset 2. The presence of a wide range of classifiers, as mentioned earlier, such as the KS star, the RandomCommittee, the randomized filtered classifier, the random forest, and the random tree, all achieving perfect scores in all metrics, highlights the significance of using multiple classifiers when working with interactive datasets. So, the 4 RandomCommittee classifiers are highly suitable for managing heart disease datasets according to the thorough assessment of classifiers. And in conclusion, this paper looked at 4 common feature selections and rates them. The classifier attribute eval, classifier AE, correlation attribute eval, correlation AE, gain ratio attribute eval, gain ratio, and info gain attribute eval, info gain. The result indicated that the gain ratio attribute eval is the most effective strategy in terms of all performance measures and datasets. The consistency, high average score in accuracy, precision, recall, and F1 score, as shown in tables, confirm the usefulness of the feature selection method in identifying significant characteristics for heart disease-related data selection as an effective feature selection strategy, and it is an essential for optimizing both performance and the interpretability of the model. As GainRatioAttributeEval is widely used, it's shown that it can be relevant characteristics in dataset about heart diseases. This makes the machine learning model used in this investigation more useful overall. In conclusion, this paper resulted in that testing classifier and choosing features show how important it is to use a complex approach when working with hard data sets. It is highly suggested that use a random committee classifier along with gain ratio attribute eval feature selection for dependable result in terms of F1 score, accuracy, precision, and recall. And in regard, the future work researcher and participants in this field of the heart disease prediction and management can utilize these findings by implementing the discovery optimal classifier and feature selection method to improve the dependability and efficiency of their machine learning model. Thank you.